We're about to get started. So hi everyone, my name is Annie Yu and I'm the Senior Policy Analyst with the Voices for Healthy Kids team. And I'm going to kick it over to Jasmine to introduce herself.
Hi, everyone. My name is Jasmine Hooper. I am the Equity Strategies and Partnerships Manager at Voices for Healthy Kids. Wonderful to meet you all.
Awesome. We're so excited to dig into research and data collection today. So next slide, please. So today we are going to introduce the Power Prism as a tool to help you move your advocacy campaigns and your work forward. And we're going to actually dig a little deeper into research and data collection in particular, which is one of the advocacy tools within the Power Prism framework. Next slide. So you might be wondering, what is the Power Prism? So the Power Prism is a framework for recognizing and acting on opportunities to help you build momentum in an advocacy campaign. The foundation is 6 power tools that will help you apply pressure on decision makers to give you what you want. And you can see the 6 tools here. You'll see that research and data collection is one of them. Another one is coalition building and maintenance, fundraising and development, grassroots and key contacts, media advocacy, and decision maker advocacy. Next slide. The Power Prism really revolves around 3 key questions that should guide your campaign. And on the next slide, you'll see these 3 questions outlined. Next slide. What do you want? Why do you want it? And who has the power to give it to you? Some important things to note and think about is that we really want to center the communities most impacted and ensure their voices and needs are heard and uplifted. So when you're thinking through these questions, consider the policy changes that communities want to address. What data helps their case? And which decision makers have the power to make that change? And revisiting these questions throughout your campaign, because some of these answers might change throughout. Next slide. Today, we are going to focus on research and data collection. For any policy campaign, it's crucial to present data that defines the problem, the communities impacted, and the science that supports your policy solution. Without this research and data as the foundation to explain your problem and justify the solution, a proposed policy really lacks the credibility and is unlikely to gain the support of decision makers who have the power to give you what you want. So all 6 tools of the Power Prism are important, but research and data collection is the one that really has to come first and be a part of the continuous process. New studies are always coming out and new findings are always coming out. So monitoring for these insights can really strengthen your influence and help advance your campaign. Next slide. But first, let's take a step back. I know that when we think about research and data collection, our minds often jump into scientific studies and a lot of numbers. I know that I'm getting a lot of flashbacks to trying to understand statistics, confidence intervals, and a lot of journal articles. But scientific literature is just one piece of the research and data collection. We need to think a little bit more holistically when it comes to research and data collection, especially if we're talking about equity-centered policy campaigns and driving equitable change. Next slide. So let's dig into some of the different types of research that can inform your campaigns. Next slide. So research really includes anything from the quantitative numbers data to some of the more qualitative experiential data. You might look into the scope of the problem, really grounding your advocacy in the communities impacted. Think about how many people are affected, who is the most impacted, and really highlighting disparities to make the case for urgency and also think about the equity implications. You can also look into community-informed research that centers lived experience, and we'll dive a little bit more into this in the next few slides. You can also research the community-level history of systemic racism and health equity or inequities to really understand how historical legacies contribute to people's access to resources and trust in institutions. You may look into the impact of policy. Maybe there are examples from other places that can show how your proposed solution will be effective. I like to call these bright spots. And you might look more and dig into the policymaking and campaign landscape, looking at the right side of the right side column. What is the official decision-making process? Who are your key decision makers? What messages resonate and are effective with these decision makers? And where is public sentiment? Next slide, please. I'm really excited to dive into community-informed research and thinking back to the very beginning of the presentation when we talked about centering communities most impacted. A community-informed research approach actively brings community members in so that they're not only there to shape or implement the research, but it really does provide a deeper understanding of where the community lands on issues. Next slide. The slogan from the disability rights movement really captures this sentiment. Nothing about us without us is for us. And it really emphasizes the need for people to be actively involved in decisions that affect their lives. And policies, programs, and research should be developed in partnership with communities and the folks that are impacted. Next slide. So from the very beginning, your campaign should really pause and ensure that community voice is represented from the very beginning and throughout implementation and evaluation. It's a continuous process, and here are some questions to consider. Has the community most impacted been included, and how? Is there a perceived or real need for policy change? Are we saying there is a need, or is the community saying there is a need? What is the community saying, and what are they actually experiencing? And lastly, does the community want to take this on? Is this a priority for this community? And a great way to really answer these questions is to bring in grassroots and community-based organizations that are really good at engaging community members with ongoing dialogue and incorporating their input. And these organizations will continue to be your key partners. It's also important to, again, see this as a true dialogue. Not only do we want to bring the insights gathered from the community back to them, but we really want to help enable them and to really equip them to use that data and research for themselves. I think too often communities are asked to share their time, stories, and expertise, and they don't really get to see the outputs of their work. So we want to avoid being extractive. Let's be transparent. We'll share our findings and updates, credit the community, and create opportunities for the community to stay involved. And this, again, goes back to the idea of going beyond a one-time consultation, but building an ongoing relationship for accountability. Next slide. Some examples of community-informed research that here are some of the examples of community-informed research that may already exist and have been completed by community partners. For example, local health departments, hospital systems, and more may already have reports and insights from the community that can help your campaign. And they're a really great starting point to build from. For example, nonprofit hospitals in particular are required to do a community health needs assessment, a CHNA, to really understand and then address the community's needs. The Urban Institute also has a really great resource called Data Walks, and it is a tool that helps make data and research more accessible and actionable for communities. What this involves is having participants go through stations where data is displayed visually and textually for participants to interpret, discuss, and reflect in small groups. So you're bringing not only researchers and community organizations in, but also community members so that it creates a conversation to talk about the data and also give an opportunity to understand the context. What is the research showing and why might we be seeing these things? Next slide. It's also important to recognize that credible, actionable insights don't just come from formal data systems. Informal and grassroots systems like community coalitions, faith-based organizations, personal stories, and more add a lot of context and color and are places where people are naming the challenges and the solutions that they are experiencing every day. This knowledge makes the data come alive, and it reminds us that advocacy is most powerful when it really reflects people's real life experiences and priorities. So pairing both the formal data, something that you might see from the science or the literature, as well as the informal data sources, just everyday people's experiences, can help ensure that your campaigns are both data-driven and community-informed. And it's best to have a combination of both. Next slide. We can dig even deeper to understand the community context. We need to understand that people don't exist in a vacuum. We are all shaped by the places we live in, the histories we inherit, and the systems that surround us. So keep this frame in mind. And I like to do this by exploring 3 key questions. What are the most pressing concerns for residents in the community today? How has history left its mark in the community? For example, how has the history of stuff like structural racism, like redlining, displacement of Indigenous folks, impacted the health and economic disparities that we see today? What strengths define the community and what community strengths can be built on? And these could be some of the bright spots that I mentioned before. It's important to look beyond a deficit mindset. And too often, when we're talking about data and communities, we're focused on what is lacking, what's broken, or what's wrong. But communities are also more than that. They're places of strength, resilience, and innovation. For example, in many Indigenous and immigrant communities, traditional medicine is a source of care that reflects deep cultural knowledge, and healthcare that is responsive to and honors these practices is more likely to be trusted, effective, and embraced because it really respects people's identities and ways of living. So these community contexts can make the data more meaningful and actually ensure that your campaign is responsive to the communities most impacted. Next slide. Now that you are equipped with all this knowledge and ideas about community-informed research and the different types of research, I'm going to hand it over to Jasmine to guide you through what comes next.
Thank you so much, Annie. So now that you know all the different types of research you'll need when planning your campaign, it's time to build your case. And you're going to do this through appealing to your key decision makers and their supporters. Next slide. So don't worry about turning your key decision makers into experts on your issue. That's not required. All you need to do is build a case that they can understand and that appeals to them as well as their supporters. And luckily, Voices for Healthy Kids already has many resources that you can use to gather information on the problem and policy solutions. Research into the problem you are trying to address will need to be shared with your grassroots advocates, prospective or current coalition partners or members, lawmakers and their staff, public officials, and as well as the media. Next slide. When presenting the problem, we want to make sure that we have data that at the minimum includes the scope of the problem and demonstrating how many people are impacted. So, for example, if you can collect local data on the number of residents in your community who are on SNAP or EBT, or just any local data that really gives concrete numerical data, you want to have data that shares the health effects of the problem. So if you are working on a tobacco campaign, if you have data that illustrates the amount of people who are exposed to secondhand smoke and what are the effects of secondhand smoke, if you're fighting for clean indoor air, that's really compelling. And of course, you always want to have demographic data, characteristics of those who are most impacted. So age, race, income level, educational level. And last but not least, you want to illustrate the impact of systemic racism on health inequities. Next slide. But as I mentioned before, the more local the data, the better. And this is also going to be dependent on what level of government you're looking to pass the policy. If you are passing a policy within your city, it will be great to be able to provide council members data in their district. That really shapes a campaign. So for example, in 2022, Voices for Healthy Kids funded a SNAP incentive campaign, and those of us who were in the city of Atlanta met with city council members, and we were able to give them district level data that let them know the exact number of constituents in their district and really the exact number of voters in their district who were eligible for SNAP or were currently on SNAP. And those numbers and being able to provide localized personal data really was a game changer in our campaign. So as local as you can get, and let's please move on to the next slide. And it's critical to also present how the problem will be improved by the policy that you are looking to pass. So think about this in terms of ROIs or return on investment, especially when it's a budget appropriation. So whenever possible, make this, again, local and personal to lawmakers that you're trying to persuade and appeal to how they will create change in their own districts or their county or your state. Let's move on to the next slide. All right, so once you have data, once you have buy-in and feedback from your community, and you know that this is something that your community or your state needs, it's time to research the legislative process. And if you can, in the chat, I would like for everyone to rank your advocacy experience from 1 to 5. 1 meaning, little to no advocacy experience, and 5 being that you've actually ran a campaign before. So if you can drop it in chat, that would be great. So let's move on to the next slide. Okay, so this is what you're going to research when you're looking up the legislative process. You're going to find out who are your key decision makers. You're going to be researching who are some potential bill sponsors. And really important, you're going to be looking up the timeline for your campaign and key milestones. So you're going to be looking up, if you're not already aware, let's say if you're a 1 or if you're a 5, you're going to look up when is your legislative session if you're looking to pass a bill on the state level. Or if you're working more locally in the city or the county or parish or whatever your local government is called, you're going to look up when they're, what kind of calendar are they on? Are they on an annual calendar going from January 1 to December 31st? Or are they on a calendar where their budget needs to be passed and finalized by June 30th? So that's going to be really important because right now it's June 12th. Let's say myself and some coalition members were to come together and say, we need to pass, free school meals for all. And we're wanting to pass this now, we may be a little too late and we may need to look ahead and plan ahead for the next fiscal year. So let's move on to the next slide, please. And so if you are a 1 or really any number less than 5 where you're not as familiar with the process, but you want to make policy change and you know that you have the backing of your community, you have data to support, what you can always do is call your official clerk's office. And they will help you determine, is it best for you to pass this policy on the city level, the county, or the state, or maybe even federal? Maybe you've taken on something so big where it needs to go to the federal level, but likely local. And so you may have to speak to a few people. Don't be surprised, be patient and be friendly, because a tip from those of us that are at the 5 level is that the admin staff are going to be your gatekeepers to these key decision makers. It's unless you have a personal relationship with your lawmaker, it can be rare to actually interact with them directly. So you may be talking and working a lot with the admin. So we always, little tip is to be friendly and patient. And in the chat here, we're going to share a script for you. It's called Questions to Help You Research the Policy Making Process. And this is a script to help advocates who are newer know where to begin in finding out this information. So let's move on to the next slide, please. So now we're going to talk about key people in place research. So very important, you will need to research who the key decision makers are, what makes them tick, and you're going to gather information on who would be the best sponsor for your bill or your piece of legislation. Next slide, please. As you remember earlier on, Annie mentioned that there are 3 key questions. So right now we're looking to answer the 3rd question. Who has the power to give it to you? Or who has the power to give you what you want? So we can dig in and we can ask ourselves, which specific decision makers have the power to make that change? So let's use the example of working on the city level again. Here in Metro Atlanta, we have some cities where we have a strong mayor and, the mayor may have actually voting power. We have some cities where the mayor actually doesn't vote. So you want to focus on building relationships with the city manager and with the city council members. So it's really important to know who has the power to make that change. And depending on your area, it may be different. Okay, so again, if you don't know who that is, it's always best to reach out to your city clerk to find out more. And once you know who those key decision makers are, you want to know what motivates them. And then you want to know how will you access and influence them. So let's move on to the next slide, and we'll talk a little bit more about influencing your key decision makers, AKA pathways of influence. Okay, so what you're going to do is you're going to be looking at the network that you already have. And here's a plug. If you're just starting out with your coalition or with your organization and you want to expand your network, we recommend that you join the NCIT. And we're going to drop the link in the chat so that you can sign up. So this graphic here illustrates ways that your organization or your coalition may already have internal resources to help you reach that decision maker. So let's say, for example, the blue circle in the middle is your city council member. You may have someone in your grassroots network, or you may have a donor or a funder who has who maybe is a part of the same church as that decision maker or that lawmaker, or maybe they are both a part of the same fraternity or sorority, or maybe they went to the same undergraduate school and they're buddies. So you want to do some digging within your own network of board members, key contacts, friends, grassroots to find out, does anyone have a relationship to this lawmaker? And if you find that you don't, and if you find that the NCIT doesn't, and you find that you have a little bit of extra funding, you might go ahead and hire a contract lobbyist to help you bridge that gap. So let's move on to the next slide. So next, you're going to be researching who your bill sponsor will be. So this is your most important legislative champion. And when researching and drafting a list of potential bill sponsors, you want to ask yourself and your coalition the following questions. Do these folks on this list of potential bill sponsors care about this issue? Do they represent me or you or anyone in your coalition? So meaning, do you or anyone in your coalition live in that lawmaker's district? That is going to be really, really helpful. You're also going to ask, does your potential sponsor have a good relationship with the leadership of the committee your bill has to go to? So, for example, if you know in order to pass a successful policy campaign, your bill has to go through the Ways and Means Committee, but you have been researching a bill sponsor who is at odds with the chair of that committee, you may want to reconsider who your bill sponsor will be. And third, you're going to ask, do you know of a professional lobbyist, again, who works for a partner organization? And what can they tell you about your potential sponsor? So again, for those of us who are maybe a 1 or a 2 in the advocacy experience spectrum, a contract lobbyist is kind of someone that you can hire to help give you that inside scoop on your lawmaker. They can share with you what are the relationships between the lawmaker and maybe the chairs of the committee. So they can give you that inside scoop, but it does typically come at an extra cost. All right. So also, some other questions that you might want to consider. Has this bill sponsor already spoken about your issue publicly? Have they already voted on this issue favorably? Have they gone on record to support the issue that you're looking to address? So let's move on to the next slide, please. All right, so now we're going to talk about a co-sponsor. So you'll have a main sponsor, and if you're lucky, you will be able to secure a co-sponsor. And this is really important because you really want to make sure that you are able to be as far-reaching as possible. Let's say you're passing a policy on the state level, and your co-sponsor, he or she is great. They have great relationships with the leaders of the committee. You know that this is going to be successful. However, let's say that lawmaker represents the southern region of your community or your state. It would be really great, or it would behoove you to get a lawmaker who represents the northern region. That way, when you put this bill on the docket, you have support from the whole state versus, you have strong support from the southern side of the state, and really the northern side feels like this bill is not relevant to them. So you really want to get, make sure that it's regionally covered. You want to make sure, if you can, to strive for bipartisanship coverage. It's best to have a co-sponsor and a sponsor who are on both sides of the aisle versus just one or the other. And all of this really just increases your likelihood of getting your bill passed. So this is really key to remember. And we do have some examples of success, how bipartisanship can be successful. So three bills or three states passed, the only three states that passed paid family medical leave, I believe, did have bipartisanship sponsorship. So it's really important to do that. So let's move on to the next slide, please. Okay, so this is just another visual to show you how questions you want to ask when deciding how to influence your decision maker. So again, you're going to ask, do they have personal connections to the issue? We're really finding out, are they motivated by this? What is their social media presence? Do they talk a lot about your issue online? You can look on their LinkedIn, their Twitter, sometimes their Instagram, but lawmakers are really present usually on X, or what we used to call Twitter, and LinkedIn. You may want to ask or find out, what are their favorite sources of news or info? And you may say, well, how will I know that? Well, again, if you go on their social media, you may notice that they repost a lot of news from CNN or Fox, so you do a little bit of digging there. So let's move on to the next slide, please. All right, so another area that is not really mentioned often, but we don't want to overlook it, is researching the opposition. You don't want to be blindsided when you're doing all this great work to support this bill, and there may be a coalition equally as powerful or as influential that they're gaining traction, but they're vehemently opposing your bill. You really want to make sure that you're doing research to find out what your opposition is. Let's go on to the next slide. So opposition can take many forms. It can be industry interests that oppose policies that may impact their bottom line, or it can be key decision makers, peers that might oppose the policy that feels like it affects their district in one way or another. So let's give an example here. Again, I'll use the tobacco campaign example. So many times, some of you listening or on the line may be very familiar or not as familiar with those of us who are fighting against, fighting to protect folks from secondhand smoke exposure and tobacco products in the industry as a whole. So you may be looking to pass a policy in your city that says, we don't want any smoking in public spaces indoors, but the tobacco industry may say that's going to affect our bottom line, and they have a lot of money. And so they likely are working behind the scenes to influence the decision makers that you need to get to, and they may be funneling campaign dollars to them. So it really is important to do some digging before you put this bill forward to find out, is your bill sponsor or is your key decision maker being funded by your opposition? Are they friends? Are they a part of the same organizations? You want to really find out, who are their buddies, who are their peer lawmakers. Even if your bill sponsor may not be directly connected to that industry that's opposing your bill, maybe their close friend that they always vote similarly is funded by that industry. So it's so much research that you have to do, but it's also critical. So we want to make sure that we highlight that. Let's move on to the next slide, please. All right. So again, this is just more details on how to research opposition arguments. So you want to look at official testimonies, statements to the press, how they position the issue on their website, advertising or other communications. And you can ask elected officials what they might be hearing from opposition. Now you want to be tactical about how you ask those questions. Subtlety is key there, but sometimes you can't ask that outright. And you also want to figure out how the opposition can reframe, how their arguments can be reframed. So knowing how you will be opposed gives you the opportunity to think about how to shift that perspective. So I definitely recommend, if possible, get with your marketing team on that. Or again, you can always reach out to your friends at Voices for Healthy Kids. We have resources on this. And we're definitely happy to help you figure out your messaging if you find that you have some clear opposition there and you want to figure out how you can strengthen your argument or your talking points. Next slide, please. So putting all this together would be power mapping. And this is a chart to illustrate that. So all campaign strategy should be focused on the decision maker target and how to leverage influence. So right there in the middle, the blue circle is your target decision maker, the person who has the power to get you what you want. And then we see a line to the pathway of influence. How can you influence that decision maker? Do you have a coalition member who is best friends or sorority sisters with that decision maker? You might ask that coalition member or that board member to conduct the first outreach. To rather than you do it, which would make it a cold call, you would ask your coalition member who's a sorority sister, hey, can you send this email or can you reach out to their staff and ask for a meeting? And that decision maker will be way more likely to talk to them and meet with them about this issue, and they'll be warm to it if they're not already. And so, you know, that's a campaign asset, and the person who is your board member or your coalition member is the liaison. So again, we're going to share in the chat links to ask for some technical assistance support if you would like help on power mapping or you want to learn more on how to do that. Next slide, please. All right. So again, we've already kind of talked about some resources here, but again, this is really our bread and butter here at Voices for Healthy Kids. We can go to the next slide. Thank you. So for free, we offer policy change and campaign consultation support. We have staff who have expertise on various issues. We have marketing communication staff that can help you craft your messaging. And, you know, the Power Prism is just such a powerful tool in helping with all of this. So we will drop the chat on how you can connect with us if it's not already in there. And I think, can we move on to the next slide? So just a little more about some of the areas that we do provide technical assistance. So we help with, we can provide technical assistance with fundraising and development, with legal review, with media advocacy, with national partner engagement. Again, that would be through the NCIT, and the link to join is in the chat. We can help with policy language development, review, potentially polling and focus groups, subject matter expertise, the list goes on. So please do, don't hesitate to reach out to us if you need support there. Next slide, please. We also have, when we offer free research and data support. So the AHA does offer scientific review. So let's say, now this is key, you never want to give a lawmaker faulty data or information that you're not certain on. So if you have some data points that you think are compelling, but you're not quite sure if it's true or if it's fact checked, we do offer scientific review here. You can submit a one-pager or a presentation or whatever you have that has data on it, and we'll be happy to review it for you. And if you don't want to do that, if you just want to check out what research we already have, you can check out our fast facts. And again, we do offer legal technical assistance, which is really helpful. Because again, if you give a lawmaker or your bill sponsor incorrect information, and that bill sponsor goes on the record and cites incorrect data, the media may tear them apart, their coworkers may tear them apart, and that would really hurt their reputation. So you want to protect the reputation of the people in office who are supporting you as much as you can. And so just make sure you're doing your homework and your research before you put it in front of them, and we're here to help you with that. So let's move on to the next slide. And again, messaging research, this is another resource that we offer. And, you know, we do offer help with health equity messaging, but we also do offer support with messaging if you're working with a lot of conservative lawmakers and you need help with centering your argument that would be attractive to them. And we can go on to the next slide. So this is just a screen grab of what our fast facts section looks like, and just some of the great resources we have. So we can just go through the slides and just for folks to get familiar. But again, we have put the links to all of these resources in the chat. Andre, we can go on to the next slides. And for those in the recording, please feel free to go to our website and check out, these campaign toolkits on our website, and you can reach out to us if you would like to explore some technical assistance support. So we thank you so much for your time. We hope this is helpful, and we have many other modules going over some of the other sections of the Power Prism, and we would love if you can please fill out the survey at the end, just sharing how satisfied you are with this training and how confident you feel applying what you've learned here and more. Thank you so much.